Post-traumatic stress disorder, or recalled as PTSD, is a mental health condition that can develop in people who have experienced or witnessed a traumatic event. It is characterized by a range of symptoms, can persist beyond the initial traumatic event, and significantly impact the individual's daily functioning. The first diagnosis is exposure to a traumatic incident. Through direct experience watching the event or learning about it happening to a close family member or friend, the person has been exposed to a real or threatened death, major injury, or sexual assault. The second diagnosis is avoidance behavior. The person makes a conscious effort to avoid thoughts or reminder of the traumatic experience. They could steer clear of those who or which they associate with the trauma. The third diagnosis is duration and functional impairment. The symptoms listed above last for longer than a month and significantly affect social, occupational, or other critical areas of functioning.
The first symptom of PTSD is intrusive memories, which is distressing and unwanted memories of the traumatic event, flashback, or nightmare. For example, a person who survived a car accident may have vivid and distressing memories of the crash even when they try to avoid thinking about it. The second one is negative mood and emotion, which is persistent negative thought and emotion, including feeling of guilt, shame, fear, or anger. Someone who experienced a traumatic event such as a sexual assault may feel intense shame or guilt about the incident. The warning sign of PTSD is first, negative mood and emotional changes. Individuals may experience persistent negative emotions such as sadness, anger, guilt, shame, or hopelessness. They may struggle with the feeling of detachment, emotional numbness, or a diminished interest in previously enjoyed activities. The second one is changes in cognition and mood. People may have trouble remembering aspects of the traumatic event, experience difficulty concentrating, exhibit negative self-perception, or have a distorted of blame or guilt related to the event.
There are three effective treatments for mental illness recovery, which is physiotherapy, medication, and combination treatment. For physiotherapy, it has been widely used to treat various mental disorders. There are three different types of physiotherapies: individual therapy, cognitive behavior therapy, and group therapy. For medication, it often used to treat mental illness. There are three different of drugs, which is antidepressant, anti-anxiety medicine, and mood stabilizer. The last one is combination treatment. The most effective treatment is combination between medication and physiotherapy. This effective treatment actively used to treat disorder like major depression, panic disorder, and etc.
Alright, so treatment for PTSD is the patients need to adopt a healthy lifestyle. First of all, they can have a relaxation technique such as doing yoga. This stimulates body to release a hormone that relax the body. Secondly, they need to adopt a balanced diet. Balanced diet can help body to recover faster and also have a stable hormone. And last but not least, get enough sleep, because without enough sleep, people tends to be very angry and also not emotionally stable. That's all. Thank you.
There are many ways for survivors can do in order to heal from post-traumatic stress disorder. One of the ways is find a helpline such as Buddy Bear Children. Buddy Bear is a safe space for children and teenagers to share about their worries and concerns to an adult trained in psychological first aid. Next is Befrienders Kuala Lumpur.
Befrienders Kuala Lumpur offer free and confidential emotional support to anyone feeling depressed, distressed, and suicidal.
How to take care of someone with PTSD. First, listen to them. You could help them by giving them time to talk at their own pace and allowing them to be upset about what has happened, and we must not make an assumption about how they feel right now or how they felt in the past. Second, try not to judge. If you have not experienced PTSD yourself, it can be hard to understand why your friend or family members can seem to move on. It's understandable to wish things could get back to normal, but it's important not to blame them or put pressure on them to get better without the time and support they need. Third, learn their triggers. Each person will have different experience of PTSD, so it might help to talk about what sort of situation or conversation might trigger flashback or difficult feeling. Understanding their triggers could help you to avoid this situation and feel more prepared when flashback happen. For PTSD self-care, first meditate. When practicing mindfulness, you can become more cognizant of bodily sensation, thoughts and feelings and learn PTSD triggers. Second, stay active. PTSD and exercise can be a beneficial combination, as exercise reduces mood and can help with PTSD symptoms like anxiety and irritability. Third, find creative outlets. Creative outlets such as art therapy for PTSD and music therapy for PTSD can have a positive effect on symptoms.